Two nonprofits are now suing community health systems for wrongfully misdirecting funds from Community Regional Medical Center. On this Wired Wednesday, GVWire.com's multimedia journalist Edward Smith is here to share what could be at stake for low-income patients in our community. Edward, thanks a lot for being here.
Morning, Kim.
Good morning. So what do these groups accuse Community Health of doing?
So as Clovis community has expanded, they're accusing community health systems of diverting up to $1 billion to Clovis community away from Community Regional. They said that I mean, if you've driven past Clovis community, you've seen how much it's grown, as much it's grown. They say that it's not appropriate, that they're misdirecting those funds that are supposed to be directed for low-income patients.
How does Medi-Cal coverage contribute to Clovis community?
So it's actually more significant than I think. You know, than those people realize. Yeah. I mean, it's grown in the last 5 years. It's grown 50%. Now, it's less than most other area hospitals, but it also has grown faster than other area hospitals. I mean, but still, government-funded programs make up over half of the income at Clovis community.
Okay. So what does California and federal law say about how hospitals can use Medi-Cal reimbursements?
So following that lawsuit, we had a chance, over at GVWire, we had a chance to talk to a hospital expert who actually authored the program. And, you know, since Medi-Cal is a reimbursement, there really are no restrictions for how a hospital spends its money. It's really dependent on, you know, how they see it being most effective.
Okay, when we talk about being effective, why do some, though, say that Medi-Cal reimbursement is truly unsustainable?
Well, because Medi-Cal at best rates only provides 68 cents on the dollar. So if you're providing $100 of care, they're only paying you $68 at the best rates. So what a lot of hospitals rely on are those private insurers, those commercial insurers, you know, people with good insurance to make up that gap. So while the lawsuit says that community is subsidizing Clovis, it's very likely it's the other way around, where you have a better payer mix who's able to subsidize the other way around. So,
is there any concern that either of these hospitals could end up having severe financial problems or care problems because of this?
Well, you look at the books; they do look pretty good, financially. But we've seen, hospitals are on. I mean, Medi-Cal is unsustainable. It's shut down in part Madera Community Hospital. Right. California takes a lot of money. I mean, the rate that we reimburse hospitals for Medi-Cal is. I mean, multiple people have said it's unsustainable because of the standards and the laws.
Wow. Now, and there's a difference between Medi-Cal and Medicare, right? Yes. So Medicare is fully paid for, is that right, by the state or the government? Medi-Cal is? So
Medicare is for, elderly over 65, mostly in California. And so so Medi-Cal cannot exceed, the Medi-Cal reimbursement cannot exceed Medicare. So that's actually the ceiling that it's set. So Medi-Cal's reimbursement rates are capped at Medicare's.
Okay.
Yes. It's very confusing. They do not make it easy.
No, not at all. All right, well, Edward, thank you for doing your darndest, though, to try to clear it up for us. We really do appreciate it. On this Wired Wednesday, we will be right back.